Public engagement is about keeping research real and keeping research relevant, and it's about ensuring that we have the voice and the input of people who the research is targeted at. So we do research in healthcare and universities and in hospitals, which is about caring for the public, about improving the health of the public and patients, service users, and making the life for carers easier and more effective as well. So if we don't engage those people in research, right from the beginning where you have the question and deciding what the right question or questions are, all the way through what the research should look like, how we do it, what we found, what it means, right through to how do we make it change what we do, and I don't think we've got it right.
Public engagement in research is about involving members of the public, patients, you and me, in the designing of research questions and undertaking the research, and basically being part of the process from beginning to end, I would say.
We have developed a tool called the Health Inequalities Assessment Tool, which is a new tool that we've developed, which actually means that whatever research people are beginning to think about and designing, they have this tool that makes them think and ask questions about, so what are health inequalities? How do they relate to this? What are the different types of health inequality? How do we understand them? How can we design the research to look at them? How do we do that? And in every stage of that process, public involvement is one of the key things that you have to demonstrate you've done to help answer those questions and look at those issues. So that's how we make sure that the focus is always about health inequalities.
We need to have a greater understanding on what is going on, what's causing these issues, and actually to help us solve this. And I think this is where public engagement has a real good opportunity to shape this. And
health inequalities doesn't mean I have diabetes, therefore I'm sicker than somebody who doesn't, and therefore my health is unequal. It's about why do I, as a middle-class, middle-aged male, my experience of diabetes might be different from somebody who's living in a very different environment, black ethnic minority, maybe not in work, maybe not having access to secure housing, all the difficulties they would have in managing their diabetes, and how we begin to tackle some of those issues, people's access to healthcare, their ability to take part in the different things that are offered, all of those things, that's about health inequalities.
3 words that sum up public engagement. Okay, so I think that 1 is about listening. I think it's about giving people the opportunity to have their voice heard. 2, I think, is about connecting. So it's about connecting with individuals or organisations or, as I say, the public. And I think the 3rd is probably a partnership.
No box ticking.
Means to an end, respectfulness and valued.
Empowerment, vision, opportunity.
You know, coming from the traditional world of research, I wasn't taught or given to understand that public involvement was important. It seemed a bit sort of difficult, and what would they know? And you first meet the public and you ask them questions, and you ask them in the wrong way, and you think, but we can't research that. We can't. You think of it from an academic viewpoint. I'm thinking sort of 20 years ago, and you think, well, how can we do that? That's not going to get published. And then you evolve through that to realise actually that it's not just about publication, it's actually much more about how we do the right research in the right way that means something. That isn't just about a name being on a paper that a few people read but nothing changes, but actually about making a difference.
I've had public involved in many projects over the years, and I think there are very, very few exceptions where it hasn't made a significant difference.
Honesty.
Empowerment.
Quality research.
Empowerment, respect and loyalty.
Optimization, sustainability and vision.
My 3 words are empowerment, honesty and purpose.
We want to get a user view so that it's something which the people with particular conditions can be happy with, and not just what we think is good for them.
Public engagement is not only important, it's essential, because if we're asking research questions, they need to be based on what the public and the patients need and want. So public engagement means that the research is relevant, and that when we have findings at the end of the research, that we've got the right people involved to help put those findings into practice.
My 3 words are partnership, openness, and inclusiveness.
Fun, social change, and reciprocity.
All our responsibility.
Value, would say networking and improving other people's lives.
Our CLAHRC is actually quite different, I think, to what a lot of other CLAHRCs are doing, deliberately so. We very much have that sort of public health community focus, where I think we're more engaged with local authorities than the other CLAHRCs. We have this specific focus that all of what our work has to be about health inequalities, and by that we fundamentally mean the socio-economic aspects of health inequalities and how they impact on people's access to healthcare and their experience of health and well-being or illness. Well, I'm hoping that members of the public and service users and carers will see this and will be able to go back to it, and our success is built upon your involvement, and if you want to be able to make a difference and contribute, then we don't just want you to, it's great if you want to work as participants in the research, but we need you engaged not just as people who do the research as subjects, but people who help design and undertake the research. We've got resources, we can help people, we can give people training, give them support, pay for their time. Our research depends on your engagement, so I hope this enthuses you to get involved.
So my 3 words, core to public engagement in research, are that it's really challenging. It challenges the taken for granted assumptions for a lot of academics in particular about who should set the agenda for research, how it should be designed, etc. The second one is that it's complex. It's complex because of the very diverse range of publics that you might want to involve in your research, the wide range of research issues, and the methods for engaging equally. And the final one is that it's really rewarding. If you do it well, if you get equal partnerships between the public and academics and service providers, then you get research which is more relevant and more likely to have positive impact.